to the wrong county. We are doing this because of the sequence.
Good morning, everybody. I'm Robin Kauser, and I am glad to be here. And thank you all for everything that you're going to have to bring to us today. I'd like to call this meeting to order. It is 10:02. This is a public meeting. It's being recorded and videotaped. And I'd like to remind you to please turn off your phones. If there's anyone here from the public to speak, if you would please fill out a form that's on the table over here. You can hand it to Delia, and she'll make sure that we get it so that we can hear from you. Okay? All right. Let me call the roll, please. Robin Kauser, present. Latricia Niagos.
Here.
Helen Masick. Betty Daniels-Mills.
Present.
And Michelle Smiley. Okay, although there are two of our members that are not here, we still have a quorum. And I think that just takes us to the third part on our agenda, to training for board members.
And that would be me.
Well, good.
Can everyone hear me okay, or do I need a microphone?
You need a mic.
Thank you. Okay, is that better?
Mm-hmm.
All right. So I am here to present your annual refresher training on open meetings. So we're going to cover three pieces of legislation: the Open Meetings Act, the Administrative Procedure Act, and the Public Information Act. These three kind of govern the rules that our meetings run by. So starting with the Open Meetings Act. The purpose of the Texas Open Meetings Act, or we'll just call it the Act, is to ensure open and transparent government. The Act requires meetings of governmental bodies to be open to the public and to be preceded by public notice of the time, place, and subject matter of the meeting. And the provisions of the Act are mandatory and are to be liberally construed in favor of open government. So the point is that the citizens of Texas and our licensees need to see the process by which their rules and regulations are made and enforced. So just to cover a few key concepts, the word quorum is a majority of the members of the advisory board or committee as fixed by rule or statute. So your body has 5 members, and as you see, we have 3 people today, which is a quorum. A quorum of governmental body, including an advisory board or committee, must be present in order to make an official action. So if only 2 of you had showed up today, we could go ahead and have a meeting, but we couldn't take any official action. It would not actually be a formal meeting, but we could discuss things, just not take action on things. And that's the third point. We may not take official action without the quorum. So the next concept is deliberation. Deliberation or discussion means a verbal or written exchange between a quorum of a governmental body or between a quorum of a governmental body and another person concerning an issue within the jurisdiction of the governmental body. So it has to meet all of these elements to be considered a deliberation under the Act. And so we're only concerned with issues under your jurisdiction as board members. And then the term meeting. So that occurs anytime a quorum of a governmental body engages in deliberation regarding public business or public policy over which the governmental body has supervision or control, or anytime the body takes formal action. Notice. The Act requires advance written notice of the date, time, place, and subject of each meeting, and we provide that notice in the form of an agenda, as you've seen. And the notice has to be filed with the Texas Secretary of State at least 7 days prior to a meeting and must be posted online by TDLR and the Secretary of State. And a committee may not engage in discussions about a subject not included in the agenda. So if we kind of veer off track, we'll try to guide you back and keep you to the items on today's agenda. So what about social functions, conventions, and workshops? So just kind of a scenario, keeping in mind that a meeting occurs whenever a quorum of a governmental body engages in discussion about an issue within the governmental body's jurisdiction. Can members ever meet in an informal setting without violating the Open Meetings Act? And the answer is yes. They are free to engage in conversation that is incidental to an event. So if you're at a workshop or convention, you can talk about dyslexia generally. You just can't discuss things that are business of your committee. So you can't discuss rule changes at a convention or something like that. Some key points to remember: always be aware of any situation occurring outside of a properly noticed meeting in which a quorum of members is present. So you have to be aware of each other's presence when you're together. And do not engage in substantive conversations relating to committee business or policy when a quorum is present and you are outside of an official meeting. And beware the walking quorum, and we'll discuss that a little bit. So a walking quorum occurs when fewer than a quorum of members engage in discussion about official business and then communicate those discussions to other members. While fewer than a quorum of members participate in the initial communication, subsequent communication with other members will result in a quorum discussing official business outside of a public meeting. So it's not just about the people who are engaged in the direct conversation. If that conversation gets relayed to other members, you could effectively have a quorum, a walking quorum. So for example, we have a five-member board, and 2 members exchange phone calls and emails expressing thoughts on an upcoming rule change and exchange research they have individually performed regarding the issue. And then one of those members subsequently forwards the email exchange to another member. The members now have engaged in a walking quorum by engaging in a small group discussion outside of the meeting. So you have to really be careful about what communications you convey to people and make sure you don't discuss or convey with 3 members total, or 3 members. So more about walking quorums. They can occur during conference calls, video conferences, even hallway discussions, emails, text messages, and we have to be careful about new technologies such as Twitter, Facebook, instant messaging, and all of those things. Especially Facebook, I would caution you about, because you're not in control of everyone who views your posts. So you have to be careful, and probably I would advise you not to post anything on Facebook about official business. So a few pieces of advice to avoid a walking quorum. Try not to meet in small groups discussing business and then communicate those discussions to other members. Try not to send emails or text messages to a quorum. Again, if those get passed on, you have a walking quorum. And again, be careful on social media because you're not really in control of who sees your posts. And should not ask a quorum of members, even on an individual basis, for feedback or comments on business outside of the meeting. This is called polling, which is essentially conducting an informal vote on an issue. So you don't even want to try to get an idea of what other board members think or how they might vote, because that could also be a violation. So some guidelines for open sessions. A committee is limited to discussing the specific items on the agenda. And during the public comment period, members of the public, of course, are given an opportunity to speak, and the presiding officer may set reasonable limits. A member of the public may raise a subject that has not been included in the agenda. However, any discussion of the subject must be limited to a proposal to place that subject on the agenda for a future meeting. And so that's why when we have public comment, it's basically a time for you to listen, but we don't engage in discussion on those issues because they often bring up issues that are not on the agenda. Some best practices: limit discussions to the specific items on the agenda. Avoid allowing discussions regarding agenda items to wander off course into new issues that are not on the agenda. Again, don't respond to or discuss issues that are raised during public comment, but which are not on the agenda. And we can specifically identify those items for future agendas and communicate those items to TDLR staff. So what happens if we violate the Open Meetings Act? There are some civil remedies. Any interested person, including the media, may petition the courts to stop actions taken in violation of the Act. And the Act also specifically states that an action taken in violation of the Act is voidable. So if we violate the Act in the course of passing rules, anyone could file suit and have those rules declared void because they were done in violation of the Act. Additionally, we have some criminal penalties tied to this. If you knowingly violate the Act, you're subject to misdemeanor criminal penalties, which could include a fine of up to $500, confinement in jail for up to 6 months, or both the fine and jail. So by accepting this position, you've also accepted some liability and potential consequences. More best practices: avoid communications that involve a quorum about official business outside of a proper meeting. And during meetings, confine your discussion to the items on the agenda. And just some resources if you want more information. I think this is also included in the materials in your packet. The Attorney General has a great open meetings training on their website. They also have a really good handbook that goes into the details of the various provisions and case law that has addressed it. And then you can find the actual text of the law itself in Chapter 551 of the Government Code. And you can always call our office if you have any questions. So moving on to the Administrative Procedure Act. The purpose of we call it the APA, is to establish minimum standards of uniform practice and procedure for state agencies and provide for public participation and transparency during the rulemaking process. So it's a very elaborate process we have to follow to make our rules. And it's kind of our Bible and general counsel that we have to make sure we very carefully abide by. So what is a rule? A rule is a statement made by a state agency that implements, interprets, or prescribes law or policy, or describes the procedure or practice requirements of a state agency. So we can't just, make policy ad hoc if it applies to the public. We actually have to go through this formal process to allow public feedback and full transparency. And a rule, it applies to policies of general applicability. So if we just have one instance where a licensee has a particular issue and we decide to treat it one way, we don't have to pass a rule to make that decision. But if it's going to apply generally to all licensees, then that we would have to go through the formal rulemaking process. A rule also, it includes the amendment or repeal of a prior rule, so we can't get rid of an old rule without going through this process as well. And a rule does not solely relate to internal management or organization of a state agency. So basically, a rule has to be something that applies to the public. We don't have to do it just for internal processes or things that only affect TDLR staff and just the way we do things. But if it affects the substantive rights of a member of the public, then it is a rule. So the ideas that kind of take shape into the rules come from many different sources. They could come from legislative changes, as one of the rules we'll discuss today has. An advisory board work group could come up with an idea for a rule. Advisory board discussion in an open meeting, or TDLR staff may just have an idea. And we also do a 4-year rule review, where every 4 years we have to take a look at our rules and make sure they're still necessary and still relevant, and kind of requires us to update our rules every 4 years. And then any interested person can file a rule petition asking that we make certain changes that they've requested. So in that process, an interested person, again, may submit a petition requesting the adoption of a rule. Interested person is anyone who's a Texas resident, a business entity located in Texas, or a governmental subdivision in Texas, like another agency perhaps, or a public or private organization that is not a state agency but is located in Texas. So basically, anyone in Texas can file a rule petition. So we do have some formal requirements in our TDLR rules about how to file a rule petition. Basically, you have to submit a letter with the specific changes in mind and an explanation of why you think those changes are necessary. Okay, so just to give you kind of a visual of the rulemaking process required by the APA, we start out with the idea for a rule. It can come from all those various sources that we looked at. And then we go into the drafting and review of rules. The draft of the rules are then sent to the advisory board, you guys, for consideration. And if you vote to publish those rules, then we would then file those rules with the Texas Register, where there's a 30-day public comment period. And then the General Counsel has to go in and review all those public comments and see if we need to make any changes to the rule in response to them. We do have to respond to every public comment and explain why we either made the change or disagreed with them and did not make the change. And then we bring the rules back to you with the comments and allow you to review them and either recommend adoption of the rule to the commission, or you can make some changes to the rules, or you can just cancel it out and say, no, let's send it back and start over. But assuming that you recommend submission to the commission, then we would take the rule to the commission with the comments and your recommendation, and the commission would vote to adopt or not the rule. If they do choose to adopt the rule, then we would file it again with the Texas Register, giving the public notice that this rule is about to take effect. And then 20 days after that filing, the rule would take effect, unless we've designated another date for it to take effect. You cannot designate a date shorter than 20 days, but we could do longer. So if we didn't want it to take effect until January 1st of the new year, then we could do that. And I told you about our 4-year rule review process. Here's kind of a chart that shows how that works. So once the 4 years comes up, then we file in the register a notice to the public to let them know that we intend to review these rules. The public has 30 days to comment to let us know if they think the rules are still necessary or we need changes. General Counsel reviews those comments and makes a recommendation to the commission. We would also get feedback from your advisory board. And then the commission would review the rule filings and the comments, and they may readopt the rules. The advisory board will be presented any comments and may recommend changes. And that's pretty much how it plays out. We kind of have a 2-phase process in our rule review. The first phase, we'll just adopt or not the rules in whole, and then the second, we kind of see if any substantive changes need to be made to the existing rules. So these are some resources about the APA. Again, the Attorney General's office has a really good handbook on their website that goes into the details and some of the court cases that have interpreted those requirements. The text and the law is found in the Government Code in chapters 2001, 2006, and 2007. And the Secretary of State's website has information about the Texas Register, which is where we file all the public notices. And again, you're always free to call our office with any questions you may have. So moving right along, the Public Information Act. We also call it the Open Records Act. It is intended to allow each person information about the affairs of government and the official acts of public officials and employees. The Act makes all documents, records, and other information relating to official business open to the public, with some exceptions. Public information includes any electronic communication created, transmitted, received, or maintained on any device if it is in connection with official business. So you want to be very careful about communications that you send or receive on your personal devices, because potentially it could become an issue. And these requirements are construed liberally in favor of granting requests for information. So if there's any gray area, we kind of lean in favor of transparency. So the process of how it plays out, someone will send us a request for documents, for communications, whatever it may be. If any of you should happen to receive a public information request or request of information for TDLR records of any kind, please forward it to our Office of General Counsel immediately, because we have very strict timelines that we have to abide by. And of course, if we request information from you, please be as diligent as possible, because we do have to give very prompt responses, which usually are within 10 days. And we cannot ask why someone wants the records, but we can ask for clarifications. So if we're not clear exactly what they're looking for, we can ask, what are you looking for exactly, but we can't ask why or find their intent or anything like that. And there are a few exceptions to the information we have to disclose. We do have to redact certain information, such as dates of birth, email addresses, certain educational documents, and any sort of health-related records that identify individuals or their health conditions. We would redact that information. So the Attorney General, again, has some good training information on their website, and they have a great handbook. The Public Information Act is found in Chapter 552 of the Texas Government Code, and again, you can call our General Counsel's office anytime you have any questions. We also have an email address set up where the public can send their requests, and it goes straight to our Open Records attorney. So that concludes your refresher training. Does anyone have any questions at this point? Okay, well, that concludes item C on our agenda.
Okay, thank you. We'll move on to the approval of the minutes from the last meeting, which was September the 24th of 2018. And I'm assuming everybody got a copy of those minutes. And are there any corrections to the minutes? Okay, if there are no corrections, can I have a motion to approve the minutes?
So moved.
And
This is Latricia Nyko, so moved.
and can I have a second motion?
Betty Daniels Mills, I second.
Okay, thank you. Then these minutes will be approved. Okay, moving to agenda item E, public comment. Do we have anybody here that needs to make a comment? No? Okay. And so now we'll move on to the staff reports, and starting with the licensing division.
Good morning, advisory board members. My name is April Nahad. I'm one of the I'm in the health profession. Sorry, I'm one of the team leads for the health professions team. I'll be providing you the licensing report for today. The report provides you with the total for fiscal year 2018, 2019, and first quarter 2020. So far for first quarter fiscal year 2020 for dyslexia practitioners, new license issued, we have 2. Renewed licenses issued, we have 6. Total population, we have 60. For first quarter fiscal year 2020, dyslexia therapists, new license issued, we have 19. Renewed licenses issued, we have 142. Total population, we have 895. That concludes my report for you today. Do you have any questions?
Robin Kauser, for the first quarter of 2020, that's what you're saying, is that we have 895?
First quarter fiscal year 2020 for dyslexia therapists, total population is 895.
Okay. Questions?
Okay, thank you.
Thanks, April. Okay, that brings us to the Customer Service Division.
Good morning, board members. My name is Jacqueline Rush. I'm a manager with the Customer Service Division. While you're reviewing the numbers of emails and calls that we've responded to in fiscal years 2019 and 2020, I've got some updates for you that have occurred since the last time that you all met. So in June of 2019, after many years of the Customer Service Division being located downtown at 920 Colorado Street at the EOT building, we moved to this building. So the division is now here on the second floor. And as a part of that move, at the exact same time, we implemented a new phone system. So we're in the second phase right now of implementing different features of that phone system. The other changes that have occurred include some retirements and some folks moving on to other divisions. And so we have 2 new managers, including myself and Dawn Robinson, in addition to Tuan Nguyen, who you spoke with in September of 2018. Also, we've got 5 different teams of CSRs that now have 2 new team leads that have been added to the team since the last time that you all met. We're hiring for CSRs currently. 6 CSRs will be starting on February 1st. We're hiring for 7 more. If there are anybody that you might know that's looking for work, more information on that job description can be found on our website. Have any questions on the emails or phone calls that we've received? Okay, thank you.
Thank you, Jacqueline. All right, moving to item number 3, the Enforcement Division.
Good morning. My name is Victoria Messon. I'm a prosecutor with Enforcement, and today I'll be giving you Enforcement's report today. And as part of my presentation, I thought I would give a brief rundown of another tool that potential applicants can use to help streamline their application process and take some of the guesswork, if you will, out of the application process if they do happen to have some sort of criminal history in their background. We like to call this the criminal history evaluation letter, and that procedures that follow with that. So Texas law allows a person who is interested in obtaining any kind of occupational license the opportunity for advanced determination of eligibility from the agency that issues that license, and TDLR follows that law with our criminal history evaluation letter. It's also known as a CHEL letter. And first, the person interested in the license submits a special CHEL application along with their completed criminal history questionnaire for each offense that the person might have been convicted for, or placed on deferred adjudication or a similar disposition from a court. A TDLR enforcement prosecutor would then examine the application along with all of their documents and their official criminal history record. And they apply all the relevant law to determine whether the person would be eligible for the license. This is prior to officially applying. The prosecutor then sends the CHEL to the person, which is the letter with their determination, which advises them whether he or she is eligible for the license. The person may then use this determination letter in deciding whether to enroll in any kind of specialized training or schools that they would need to obtain that license. The law allows up to 90 days to complete that evaluation and send the CHEL, but TDLR's goal is to process all of those letters within 30 days. TDLR honors the decision indicated on the CHEL letter unless we learn of additional relevant information that we did not have available at the time of the evaluation process. And finally, even if TDLR determines a person is ineligible, that person may still apply for the license and submit additional information, at which time we would again examine their record. And the applicant could also request an administrative hearing to contest the denial. So just a little bit about additional processes that we offer to applicants. Now I'd like to switch to the statistics portion of my presentation. There was only one case opened for the dyslexia therapist for fiscal year 2019, and that case has been resolved. For fiscal year 2019, which started on September 1st, 2018, and ended on August 31st, 2019, the department as a whole opened 10,902 cases and resolved 10,113, resulting in 1,887 final orders. The department assessed $3,394,334 in penalties and collected $1,731,554. Thus far, in fiscal year 2020, the department has opened 2,655 cases, and we have resolved 2,570 of those cases, cases in general, resulting in 470 final orders. The department has assessed so far in 2020 $874,531 in administrative penalties and collected $403,443 of administrative penalties. And I'm available for any questions about any of the things I presented if you have them.
Robin Kauser, when you were talking about the opportunity for the criminal, what did you call it?
It's a criminal history evaluation letter. So basically, prior to applying and paying money for the application, you can get a predetermination letter.
Is that on the website?
That's a very good question. I would assume
This
it
is
is.
David
David Gonzalez to you.
Yes.
It is
Yes.
criminal history evaluation letter is available on the website.
Okay, perfect.
Yeah.
Okay, thank you.
Any other questions? Thank you.
Thanks, Victoria. Okay, we're on item 4, Regulatory Program Management Division.
Good morning, committee members. How are you?
Morning.
My name is Mary Hoffman, and I'll be providing the RPM report for you today. And that is for regulatory program management. I'm going to just highlight some of the items on your report that you have. The medical and health professions section continues to assist customer service with emails and phone calls. Our staff is also assisting in bill implementation teams. We assist and also lead those teams in implementing any bills that have passed this last legislative session. Specifically to dyslexia, the bills that have passed are House Bill 125, and that prohibits online publishing of home addresses, and also House Bill 2059. House Bill 2059 requires that certain healthcare providers complete a human trafficking training course as a condition of renewal. So we're working on that, implementing that bill. And so you'll get notices probably within the next few months on how we are going to implement that. The bill teams will also update any applications, webpage information, and any other program material as well. So TDLR provided a guidance document on Senate Bill 1264. That is the document that I handed to you. And what that is Senate Bill 1264 protects consumers from surprise medical bills in emergency situations and in cases where the consumer has no other choice of provider. That is a Texas Department of Insurance bill, and they are implementing that. We just provided a guidance document to assist our medical and health professions on that. And we are just providing this as reference, even though it may not impact your profession. You have the document that I handed to you, and also on that document is TDI's contact information if you have any questions. TDI is continuing to implement this bill, and there will be additional meetings being held, and TDLR will monitor the implementation and let you know if there's any major developments on this. Personnel updates. Amanda Smith has joined our team, and she is an executive assistant, and I think she is here. Is she not here? Oh, sorry, she left. She's working hard. So Amanda Smith comes to us from DSHS. She's worked in the regulatory area in DSHS licensing for several years, and we are happy to have her with us. And RPM has also received a new director in December 2019. Charlotte Milder was promoted from a section manager to the RPM division director. And I think the executive report will provide a little more information on some of the changes that we've had. The section, Medical and Health Professions section, continues to work on the TDLR Health Monitor. We have issued 9 publications. Most recently, in January, early January, we have issued that, our most recent publication. You can find that and also archived editions on our webpage. If you ever have an idea for an article or a topic that you want us to discuss, feel free to contact me, and we can try to get that into the next edition. Okay. We also want to talk about Senate Bill 202 report. The Senate Bill 202 implementation report was published. Don't have it in my report, but it was published just recently. And what that was is Senate Bill 202 transferred the 13 programs from DSHS to TDLR. And part of that bill required TDLR to provide an annual report on that implementation process. And the report provided a transition overview, a summary of advisory boards and committees, a reference to the State Auditor's Office audit report, and it also talked about current initiatives and key statistics. A link to the report can be found on our website as well, but you also have that in your packet. Okay. And another item we want to talk about is the State Auditor's Office report on the health-related programs. And TDLR was notified in January of 2019 that the State Auditor's Office was going to audit the health-related programs that were transferred from DSHS. The audit objective was to determine whether TDLR had processes and related controls in place to help ensure that the agency administers regulatory activities in accordance with applicable requirements for the selected programs. The State Auditor's Office published their report in August of 2019, and the report was included in your meeting materials as well. Overall, the audit found that TDLR had developed processes and related controls as required. However, not all processes, controls, and policies were sufficient. The audit found that certain areas of TDLR needed to be improved upon. All of the medical and health professions were audited. However, they specifically took a closer look at the speech pathology program and the massage program. One of the areas that was mentioned that needed additional strengthening was the facility inspections, which doesn't apply to this program. And another area was in the enforcement department, and that was due to some of the criminal conviction guidelines and the penalty matrix not being developed quickly enough. But that concludes my report. Do you have any questions for me? No?
Thanks, Mary.
Thank you.
Okay, we're moving along to the executive office presentation.
Good morning, board members.
Good morning.
My name is David Gonzalez. I'm with the Texas Department of Licensing and Regulations Executive Office. I will be providing the report this morning for personnel updates. So y'all are probably familiar with Brian Francis sitting in this chair often. He's got a very vivacious personality. I'm going to be trying to match that personality the best I can. I'm going to try to channel Brian Francis, but I know I'm going to fall short. What I want to share with you is that I actually predate Brian Francis. I've been here at this agency longer than he has. And because of all the workload he's taken on and all the programs we've been given over the last few years, I think he's finally decided he's going to take those broad shoulders and start shoving some of that stuff off to the sides and sharing some of the limelight and sharing some of the work responsibilities. So you'll probably see some other deputy executive directors in this seat going forward in the future. So some of the changes include we had a retirement of Ms. Carla James on November 30th. She was one of 2 deputy executive directors serving the agency. She did a phenomenal job for us. But she's passed on the reins, and Brian knew that with the growth that we've had in the past sessions that he was going to need a little bit more help. So instead of just hiring 1 replacement, he hired 2. I was one of them. I used to be the RPM division director. That's what she was referring to earlier. I actually have moved up and have taken my role as deputy, but there's also been a change in our enforcement division director. So Ms. Christina Kaiser has also become a division director, and her replacement is Ron Foster. So we had some musical chairs going on with personnel. A lot of staff that have been here for years, just taking on different roles and different responsibilities. So you're going to see some new faces. I expect you won't see too many changes in how workflow is, other than the personalities and the people that are presenting you some of the information. So hopefully it doesn't get too confusing for you. If you ever see somebody at the meetings that you haven't met, I'm going to make sure that they do their best to introduce themselves to you. But if there's somebody that you need to talk to or want to talk to, just let us know. Item B, sunset review process. So this is an important time in any state agency's history because at this time, the Sunset Commission is looking at our agency to determine, do we need to continue? Do our programs need to continue? The Sunset Commission is actually looking at all the programs that we received prior to September of 2016. So this program actually doesn't fall in that category at this time, but technically, the Sunset Commission has purview over all the administrative processes and everything that we do right now. Y'all's programs will be under Sunset Review. We're actually going to be getting a quick turnaround to get another Sunset Review in just another year. As soon as they're done with this one, they'll be starting up on the next one. But this is the time for the public to give their input. We've actually done a self-evaluation report that's posted on our website. It's also on the Sunset Commission's website as well, saying what we think we do and how we accomplish things. They'll probably be contacting, if not already, people from the programs to get input. And if they have not contacted you, that's okay. You can actually go to their website and provide input on anything that we do. Be king or queen for a day and let them know what you think about our agency and how we're doing our business. We need to hear what we're doing right and what we're doing wrong. We embrace this process because this is our opportunity to get better, and this is how we've corrected things in the past, kind of tweak things to make things better for us in the past when we know we can do better. The process involves lots of meetings. We've had at least 50 meetings since they started in October. It's going to be going on through May. Once they get their report done, it will be published, and there will be hearings held where, again, the public will be invited to give their input and give their perspective on the things that are found during the report. This is not typically a hey, everybody's happy and everybody's doing fine report. This is an exception report. They're going to see what we can be doing better, and almost all reports are going to find things that can be consolidated, moved around, or just improved in some way, or form, or fashion. So just be prepared for that and make sure to take advantage of it. Communication outreach statistics is something we've been reporting as well on a regular basis, just to let you know how effective our webpage is for y'all's particular program. So over the past 6 months, from July through January, the Dyslexia Therapist and Practitioners website has had 6,139 views and an average of 33 per day. 50% of those visitors accessed the site from a desktop computer, while 47% did so from a smartphone. The top reasons for visiting the site was frequently asked questions, apply for a new dyslexia therapist license, exam information, renewing a license, and applying for a dyslexia practitioner's license. All right, so the last item on the agenda is introduction of the Anti-Trafficking Unit, something that I know that Mr. Francis is quite proud of. Our agency, before we even had funding and really available resources, decided to dedicate a person to help with disaster response and strategic response issues we were dealing with during disasters, and anti-trafficking. We knew as a licensing agency we had a unique role with some of our programs, with electricians, with cosmetologists, with massage therapy, that we had a role and information that might be helpful in these efforts. But we did so without actually having staff on board. This past legislative session, the legislators recognized something that was been prevalent. Many cities are actually having trafficking issues, and they decided they'd give some resources to an agency that might have some effect on it. So with that, we were dedicated quite a few staff, and I'm actually going to take the opportunity to pass this on to Miss Mary Winston. I'm not sure if any of them are in the room today, but I want to make sure that we at least could give credit for the new staff that we've hired on board. Miss Mary?
Good morning, Mary Winston. Actually, they are in the other room, but they've been doing quite a bit of training, and we have quite a bit more training for them to do. This is a new chapter for TDLR. We have our enforcement division that has complaints, and they conduct investigations based on those complaints. So Texas is a huge state. Some people complain, some people don't complain. We have field inspections that conducts inspections on a periodic basis. Again, it's a periodic basis, and that's by law. And so there's a bit of a gap between when a complaint comes in and when there's a periodic inspection that's scheduled. This group has been brought in and funded by our legislature during the last session to fill that gap and to get out there and conduct inspections for illicit massage businesses. It's a new chapter for TDLR, and we have a lot of new chapters. We love new chapters, apparently. We take them on all the time. They excite me. They probably don't excite everybody here, but I'm always like, ooh, something new. It keeps the brain going, right? So this team has come in, been hired, and we have quite a bit of training that we're doing with them, because it's a possibility of them seeing some things that are, great probability of them seeing some things that are going to be a little difficult to handle. So we want to make sure that we touch self-care as well as our other employees. But with this team, we know that right off the bat, that we train them on TDLR operations in general, and that we train them on the new process and procedures as they're developed. Today, we're actually heading to Houston because early morning we have a meeting with Houston Police Department, someone from the Houston's mayor's office, as well as Senator Huffman's office, and I think Representative Thompson we had to reschedule that one. But the impact on Texas and Houston has a great number, support city, it's many factors we could go into, of having a lot of issues with illicit massage businesses, so that's part of the training. So on the team, and I'm going to go by memory, it's not like it's 25 of them, so no, that's okay. We have Alex Ortiz, and Alex he came from us from DSHS, and he has some experience dealing with, of course, the state agency. He came from us specifically to this position from TDLR's enforcement position as an investigator. We have Chuck Winkler, who came from the Arts Commission, who has some very distinct experience dealing with troubled populations. Ray Carswell, another, I'll say, TDLR repeat person. So she left us for the Veterans Commission for a while, but we got her back. And she's worked with a lot of nonprofits in this. Jennifer Ignacio, who has done training with the Texas Municipal Police Associations on various projects dealing with domestic violence, including a strangulation training that she did teach the entire state for that. Going through, that's awful. Brian Cottle, who we got as an intern and straight out of college, and he interned for us for several months, and we were able to hire him on. Gloria Newton has been an employee here at TDLR for quite a while. She's kind of grown up here, and she's continuing that growth. And Jordan Strain, we got from customer service by way of the military. So she had the occasion of handling some of the expedited phone calls for several months that have dealt with possible alleged trafficking. So she came over to the team. And they're all joining Miss Jennifer Harless, who was like a one-woman show. That she did all services, triage, getting it all up, started that SharePoint for us that we now have a foundation that we're working from. So that rounds out the team. I don't think I've forgotten anyone.
Yourself.
Oh, me. But so I'm managing the team, and it's just been such a it's wonderful to it's a very harsh subject and topic, but to bring in that kind of Brian always uses sports analogies, so I know what this means, but just because people use it all the time, bench strength. So to bring in all that bench strength has really been wonderful. They've already been traveling on trainings. We have not let them go out of the door as inspectors yet, because they have to go with our field inspectors and learn from their expertise, and our enforcement investigators to learn from their expertise, and then bring in their own. So we'll drag them out here one day so you can see their faces and wave, but right now we are in training.
Thank you, Mary. As I said, Brian's been very proud of that. He's been an advocate, even in his own personal life in regards to these matters, so I know he takes great pride in what we were able to do initially with Ms. Harless, and with this team, expectations will be raised. I think y'all know later on in the agenda we have things that we're discussing that are related to human trafficking. It's not going to go anytime soon, and we're just proud to be part of the work that could go into discouraging it. So with that, I conclude the executive report. Is there any questions for me?
Oh, thank you so much.
Thank you.
I guess we will move to agenda item G.
Okay. Good morning again.
Good morning.
My name is Derek Burkhalter. I'm an Assistant General Counsel for TDLR, and I'm here to present agenda items G, H, I, and J for you, and kind of talk you through the issues. I wanted to apologize for bombarding you with such a large packet of information. Hopefully you didn't feel obligated to read every page of it, but I just wanted it to be there for reference, if nothing else. So moving to item G. So this is some proposed rule language that we're bringing to you to implement some legislation passed by House Bill 2059 this summer. And before we look at the rule language, I kind of just wanted to show you the language of the bill. HB 2059 is in page 62 of your materials, assuming that it's the same as the materials I have. Let's see. And I thought I knew how to change the page numbers here. There we go. Okay, so this is the text of HB 2059. As you can see, it's created a new chapter in the Occupations Code, Chapter 116, Training Course on Human Trafficking Prevention. And so again, the legislature has taken this issue very seriously, as it should be. And the legislature has identified that healthcare practitioners are in a unique position to be able to identify some of the signs of human trafficking victims in the people that they care for. And so this title applies to all healthcare practitioners in the Occupations Code under Title III. And so your Chapter 403 does fall under Title III. So you're considered a healthcare practitioner subject to this bill. I'm just scrolling down a little bit. The operative language is in Section 116.003. A healthcare practitioner, other than a physician or nurse, shall successfully complete a training course described above as a condition for renewal of a license issued to the healthcare practitioner under this title. And so, as you can see, this is a requirement for renewal of the license. So it's for each renewal. It's not just a one-time thing. And these courses, as the bill provides, they have to be approved by the Commissioner of the Health and Human Services Commission, and they are supposed to keep a list of the approved courses on their website. One of those courses has to be a free course. And if we go to their website, they've kind of given us some information about where they stand in the process, and that's HHSC. As you can see here in the second paragraph, they are in the process of developing their own human trafficking training free of charge. This requirement kicks in September 1st, 2020, and they anticipate publishing their free training on the agency's website by summer of 2020. And they also have the ability to pass rules concerning what the requirements are of those training courses. And so, we're kind of waiting to see how that plays out as far as HHSC, the course that they offer, the time period that it takes, and what sort of rules they may have as far as what's required as far as content or the timing of the course. So, let's look at the rule language that we've come up with. This should be on page 61 of your materials. So this is in our chapter of the Texas Administrative Code. So we're in Chapter 120, and 120.26 is our section on renewals. And you can see the underlined language is what we've added. This is standardized language that staff has come up with and has gone through our approval process. It just basically spells out the requirement for each license renewal on or after September 1st, 2020. The licensed dyslexia therapist and the licensed dyslexia practitioner must complete the human trafficking prevention training required under Occupations Code Chapter 116 and provide proof of completion as prescribed by the department. So we've made that a new Section B, and then we have re-lettered the remaining subsections accordingly. We wanted it to be kind of right after the other renewal requirements. Once we pass that September 1st date, we can kind of change the language and make it just kind of part of the standardized list if we want to, but for now we wanted to make it clear that this is only for renewals on or after September 1st. So this is the language that we've come up with and we're presenting to you today. It is still being reviewed by the governor's office. We don't anticipate that they would have many changes because it has already been approved for other programs. I think we have 10 programs that this provision applies to. But it is subject to any changes the governor's office may have. Essentially, I guess at this point we can talk about the language, or if you have any questions, I can try to answer that. But ultimately, we're seeking your recommendation to publish this in the Texas Register so the public has a 30-day public comment period to give us their input.
So do you need a motion?
Yes, we would need a motion and a vote.
So I would move to accept the language as presented. And this is Latricia Nygaus.
Betty Daniels Mills, and I will second that.
Okay.
And so now, do we need to still take a vote?
Yes, we would need to vote, yes.
Okay. So, all those in favor of adopting this language, say aye.
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 Okay. Have we recorded the vote? Okay. Thank you. So that will be published as soon as possible. We don't know exactly at this point. There's some more paperwork we have to do, and as I said, we're still waiting on formal approval from the governor's office. But we will keep you updated. In our next meeting, we will discuss the comments that we receive from that publication. So that concludes agenda item G. Moving on to H. This is the same topic. So the rule that you just voted on just places the renewal requirement in our rules. But our executive director, Brian Francis, wanted each board to consider whether this training that's required should be counted as part of the continuing education requirements for your program. And so this is something he wanted possibly to be presented or to be assigned to a work group to take a close look at the statutes and the rules and sort of the industry requirements to see if that's even something you would want to include, or if you want to make that something that's extra on top of the current continuing education requirements. So at this point, unless you would like to discuss it, really I think probably we should assign it to a work group so they can sit down and have a conversation, and then maybe at our next meeting we can discuss what the work group has concluded or what they've recommended. If they've proposed some possible rule language, we could discuss it at the next meeting.
This is David Gonzalez with TDR. So we already have some assigned work groups. I'm not sure if y'all remember which ones y'all are on. We have the enforcement work group with Latricia Niegos and Helen Masick. We have the licensing work group with Robin Kauser and Betty Daniels Mills. We have the education and examination work group with Robin Kauser and Betty Daniels Mills, and standard of care work group with Betty Daniels Mills and Latricia Niegos. So does this one fit into the education pretty cleanly, I think? So if y'all are comfortable with Robin and Betty Daniels Mills being on that group, we could continue on, unless y'all have the presiding officer or have some other ideas in mind.
Robin Kauser, I think that is the perfect work group, so
Okay.
let's do that.
So let it be done.
Okay, great. And just so everyone watching knows, our work groups are small meetings that include board members, but it's less than a quorum, so they can discuss and study these topics together with TDLR staff, but because we do not have a quorum, it's not a meeting subject to the Open Meetings Act. So that's kind of how we do some of the more intensive look at, and studying without having to do it in a long, extended public meeting.
Thank you, Derek, for that clarification. David Gonzalez, TDR. And that information does come back to the full board for discussion and final action on things.
Okay. Robin Kauser, will we be notified from the staff members from TDLR to get it together to have that work group?
David Gonzalez, TDR. It is my expectation that one of our staff members will contact you to initiate it so we can facilitate it. Y'all can have communications, again, with less than a quorum for the work group, but we want to try to facilitate that, so we're including all the input and keeping it organized for y'all.
Okay. Perfect. Thank you.
Okay, so moving on to item I. So the Texas Education Agency, the TEA, they have passed a couple of new rule packages since the last time we met concerning dyslexia. And although these may not actually affect our licensing or our scope of practice, I just think it's really important for us to know what's going on with the TEA and how they're handling the dyslexia issue. And kind of leave it to you as our experts to decide if we need to make any changes to our processes or our rules in response to those. And the answer may be no, but at the very least I wanted to make sure that everyone is aware of these changes. So on item I, the first change is to their rule, and it's in Title 19 of the Texas Administrative Code, and their rule concerning dyslexia is Section 74.28. And so this rule package took effect March 13, 2019. And I'll scroll down. You can see in subsection C, the highlighted portion here. Essentially, all they've done is they've added their new handbook, which was updated in 2018, and they've incorporated it into their rules. You can see right here this attached graphic. If you clicked that, it would take you to the full text of the handbook. And so they've used this to essentially make that handbook a part of their rules. So the districts and the teachers would have to follow the handbook as if it's written in the rules here. And so I included in your materials the full updated handbook. It's something like 80 pages. And again, it may not affect anything to do with our licensees, but I kind of wanted to leave it to your discretion as to whether we want to assign that to a work group to take a closer look at it to see if the changes would affect anything that we do here at TDLR. Or, you know, if you don't think that's the case, we can kind of just say, well, that's good to know, and we can move on.
Robin Kauser, correct me if I'm off on this, but the handbook is TEA, and TEA does not control the licensure for us.
That is correct.
And so whatever they have in this handbook is best practices for what they're requiring in Texas public schools. Is that correct?
Correct. So it would be requirements applicable to the school districts and the teachers who teach in those schools.
But not for someone who's licensed under health occupations.
Correct. This is not our rules as TDLR as a licensing agency. This is just anyone who would practice in a school setting would be subject to these rules, but they are not by their own nature applicable to licensed therapists or practitioners apart from the school setting.
Do you have anything you want to talk about, or changes?
So Latricia Nigos, I would recommend that it not be sent to a work group. I think all of us are familiar enough with the handbook to know that their LDT is really not mentioned in the handbook. And so it's somewhat mutually exclusive at this point unless something changes.
Okay.
David Gonzalez, that's fine. Just want to make sure that y'all have an opportunity to discuss, and if there's nothing that needs to be done, we can move on.
Okay, that sounds like the case. So we will move on to item J. Just 1 second. So this begins in page 152 of your packet material. So this is a rule package that TEA passed through the rulemaking process that took effect December 25th, 2019. So they gave us a Christmas present. This was a rule package that they passed in response to Senate Bill 2075, which was legislation I also included in your packet. I don't know that we need to look at the bill language itself because it's not applicable to TDLR. It's applicable again to the school districts and their processes. So just to scroll down to the actual changes, and again, we're looking at TEA's rules in Title 19 of the Administrative Code, Rule 74.28, students with dyslexia and related disorders. So I will scroll down to the changes that were made. And you see they've added a new subsection K here. Each school district and open enrollment charter school shall report through the Texas Student Data System Public Education Information Management System the results of the screening for dyslexia and related disorders required for each student in kindergarten and each student in grade 1 in accordance with Texas Education Code section 38.003. And so this data system is a statewide system that schools use to record data, specific data that's required to be recorded about students, demographics, programs that students participate in, and they're adding dyslexia as an element that has to be reported statewide. So that clearly has advantages to people moving across the state and things like that. And to allow the state to track the number of students receiving dyslexia services, and that would help appropriate funding appropriately. And so they re-lettered their remaining subsections accordingly, and then in what's now new subsection N, they've added some language that school districts and open enrollment charter schools will be subject to auditing and monitoring for compliance with state dyslexia laws in accordance with administrative rules that TEA has adopted or should adopt. So essentially it creates an auditing requirement to make sure that the school districts are complying with the requirements for dyslexia. So again, this is probably, and I'll leave it to your expertise, but probably not something that affects our licensure or our scope of practice, but again, just wanted to bring it to your attention and make sure we all know about it.
Robin Kauser, is this like the reporting with PEMS? So that they have to just have a subsection with the PEMS report that's specifically for dyslexia?
Yes, they will. There will be reporting on the students. Let's see the exact language. The results of the screening in kindergarten and first grade.
Okay.
So I guess for each individual student, it will have probably a little field that indicates the screening in kindergarten and first grade and the results of that screening.
I don't think that directly affects us. I mean, well, it does have an effect on us because the more students that are identified, the more need for licensed therapists
Sure.
there is, but I don't think that anything needs to be concerned, the language or anything concerning us.
So no action necessary at this time?
That's correct.
Okay. Are there any other questions I can answer at this point?
Good.
Okay, well, that concludes item J, and that concludes my presentation today.
Thanks, Stuart.
Thank you.
So we're on to item K.
Good morning.
Good morning.
My name is Jessica Hurtado, and I'm a prosecutor in the Enforcement Division, and I will be presenting the draft penalty matrix to you today. Before we get into the details on your penalty matrix, I want to go over some background information about what the penalty matrix is and what it is not and what we use it for. So what do we use it for? The penalty matrix puts the profession and the public on notice on what the consequences are for a violation of the statute or rules in your program. It also categorizes the violations, so it from the least serious to most serious. Of course, all violations are taken seriously, but in the case of violations that may result in public harm or threat to public safety, of course, those are taken more seriously and have higher consequences. Okay, and what is the penalty matrix used for? The prosecutor uses the penalty matrix when they're drafting a notice of alleged violation, what we call an NOAV. This is the formal document that is drafted and sent by the attorney to the respondent when a complaint or a case is considered to be serious enough that we need to pursue it and go forward to seek a penalty or a sanction. And so the penalty matrix binds the prosecutor in what amount of penalty can be sought or what kind of license sanctions can be sought. The prosecutor can only go outside of the penalty matrix in extraordinary circumstances, and they have to get the approval of the Director of Enforcement before they can do that. Now, what the penalty matrix is not. The penalty matrix does not create any new law. It is simply a restatement of the current statute and rules that apply to your program. The penalty matrix is not used when a case is closed informally by a prosecutor. So we have options as to whether we're going to close a case because there's not sufficient evidence, or we may find that there's sufficient evidence but believe it's not serious enough to warrant a penalty. And in that case, we may close it with a warning letter. The penalty matrix is not going to address any warning letters or any other informal type settlements of a case. Finally, the penalty matrix is not binding on the Commission of Licensing and Regulation. So when a contested case goes to a hearing before an ALJ at the State Office of Administrative Hearings, then it goes before the full commission who can decide, who makes the final decision, and they are not bound by the penalty matrix. They can go outside of it. Okay. Does anybody have a question about just generally what the penalty matrix is for? Okay. Okay, then I'll now turn to the penalty matrix for your program. The enforcement work group met on December 3rd of 2019. Advisory board members Helen Masick and Latricia Niegos met with the enforcement staff, Chris Russey, management analyst, Griselda Perez, management analyst, Karen Cox, our senior prosecutor, and myself, and we reviewed and completed the draft that you see before you today. Okay, and we've got it here also on the screen. So a few things I'd like to point out for you. At the top, you will see a listing of the statutes and rules that are incorporated into the penalty matrix. You'll also see that it's arranged into different classes of violations, ranging from a Class A violation, which is considered the least serious, up to a Class D violation, which is considered to be the most serious. There is a single penalty range for each class of violations. And this is an approach that we're taking within all the health-related programs to have a single penalty range. In some of our other programs, you may see that a penalty matrix has a first, second, or third violations. And we found that the single range gives the prosecutor more flexibility in determining the appropriate sanction or penalty based on specific facts in a case. In your type of a program, there is the potential that a very first violation could be quite serious, and so you would want to go to the top of your range and not worry about, well, they've never had a prior violation. Also, due to the high compliance in your program, it's very unlikely that we'd ever see a second or third violation. Also, we found that the three ranges can also cause confusion with licensees, with other attorneys, and with the administrative law judges, and it creates more confusion and argument, and it prohibits us from settling these cases more efficiently. And finally, the single range does fit in with the agency's strategic plan of streamlining procedural steps to ensure prompt investigation and resolution of complaints. Another thing I'd like to point out is that under Class B and Class C, you'll see a heading entitled Standard of Care Violations. This heading is a signal to the prosecutor that in pursuing a case with this type of a violation, an expert witness will always be needed. And so the expert witness would be to assist the department in gathering or in evaluating the evidence to tell us whether the facts of the case, meet or do not meet the professional standards. And you'll see the Class D violations are the most serious. Most of these are consistent violations that we have across all of our programs. For example, failing to comply with a order of the executive director or the commission. And some of them are also specific to your program. These Class D violations are typically where you're going to seek revocation of a license. Okay, I'd be happy to walk you through the classes or the violations, or I can answer any questions, however you'd like to proceed.
This is David Gonzalez with TDLR. Do y'all have enough copies up there? I see y'all looking over your shoulder. Do you need another hard copy?
I don't have a copy of this.
Is there a way we can get them a couple copies real quick?
Sure.
So is it actually on their laptops where they can get to it?
Page 1. He has another one right here.
Thank you.
Thank you, Jessica.
We were supposed to be able to walk and chew gum at the same time and listen. Look at all that. Okay, thank you, I'm sorry. Apparently it was provided for us and I didn't scroll fast enough.
David Gonzalez, TDLR. It's sometimes difficult. There's lots of materials to look
There's
at.
just yes. Like I was saying, walking and chewing gum. And listening. Okay. Well, I'm gonna stick with the hard copy. I've got it right here.
Since you haven't looked at it prior, do you want her to walk it through?
Yeah, would you mind walking us
Oh,
through?
sure. Okay, if you can go up a little to the top. All the way. Yeah. Okay. Yeah, so you'll see that we start out with the Class A violations. These are typically administrative violations or paperwork things that affect primarily the department, but not the public. And so we consider those the least serious, and you'll see the penalty range there starts at $500 up to $1,000.
Okay.
And then, Griselda, if you could scroll to B. Thank you. Okay, yeah. So Class B violations, the penalty range begins at $750 up to $3,000 and or up to a 6-month suspension of a license. And the and or really gives the discretion depending on the case. So it could be a license sanction, but it's not required.
Mm-hmm.
These types of violations, you'll see, again, administrative violations and some advertising violations. Record keeping, of course, records are always important. So those are Class B violations. And your standard of care violations there. Any questions about Class A or B? Okay. Class C, your penalty range begins at $2,000 up to $5,000 and or 1-year suspension up to revocation. Again, that and or gives the discretion. We have more serious record keeping violations and also confidentiality here. Standard of care related to treatment. And one thing I should mention is on the right-hand column, you'll see the citation to the statute or the rule. Misrepresentation violations, dealing with inaccurate or false advertising. And then we have unlicensed activity is always one of the most serious violations. And billing violations are here. Let's see. And other unprofessional or unethical conduct. These are primarily taken from the rules. Okay. And then scroll down, please. Okay. And Class D, again, is the most serious, starting out at a $5,000 penalty and or revocation. And these are, usually we call these one and done. So. And after you've had a chance to look, any questions? Sure.
Latricia Nigos, on the Class B under Standard of Care violations, the very first one says provided professional services solely by written, telephone, electronic, video, correspondence, or communication. Being from an area that's very rural, and with the few numbers of licensed dyslexia therapists that we have in our state, sometimes there are situations in where the only services that some of these very small places and far from urban areas, there may be situations in where that really needs to be a best practice. And so that might be something that we need to look into as a rule change. Just my thought.
Sure, and I think that we did discuss that during the work group, and so we decided that for now it would be Class B, but it is in the rules, so if that's something y'all want to change or discuss changing, if that does happen, then the penalty matrix, of course, would reflect any change in the rule.
How do we go about doing that?
So it's the board discretion on approval of the penalty matrix. Obviously, we'd like to be able to move forward on the things that y'all are comfortable with. If there's something that y'all wanted to amend on this penalty matrix, that's for y'all to discuss and give us some guidance. The rule changes, though, would have to come up as another agenda item. We are going to have to come back together to meet on the rules, so it would be an appropriate time to put it on the agenda for that time. We still need some time to coordinate with the governor's office and get those things posted. But from what I'm hearing from you, Latricia, it would be appropriate to at least put it on the agenda and have it discussed.
Yes, please.
Okay. Are y'all comfortable with it being on the administrative penalty matrix as present at what it was rated? Because I think I heard there was some discussion at the work group.
So Latricia Nigos, I would make the motion to accept as is, and then look at a later date about a rule change.
Robin Cowser, I second that motion. And I would just like to make a comment that I appreciate this, and I think it really solidifies and helps the licensure stand out as something that is above and beyond some other training for dyslexia services. So there's an accountability here that I think is necessary and just lends validity to our license. So thank you.
Sure, you're welcome. And with your approval, we will take it to the commission to have it adopted.
So we had a motion and a second. Now we just need a vote. You've had discussion as well.
Did you? Well, haven't we already motioned? We just need the vote?
Motion and a second, and there's time for discussion if there's still some more discussion, but now the vote would come up if there's no more discussion.
So, shall we vote? Is there anything else you want to talk about? No, I think you did. Oh.
Thank-
Okay, so shall we take a vote? All those in favor of adopting as is? say aye.
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 Thank you.
Thank you. Okay, that brings us to the agenda items for the next meeting.
David Gonzalez, TDLR. Obviously, we would bring back the rules that are going to be published so that y'all can get the second bite of the apple, see what kind of public comments we have. Any other items that y'all would want to discuss, such as the one that Leticia brought up? We can put that one on as an agenda item. I'm looking over General Counsel. Would that be appropriate?
Yes, it would be appropriate. We can also hold a work group in the meantime. We don't have to actually have formal action by the committee to assign a work group to look at the issue. So staff may put together a work group to take a look at that particular issue before the meeting, but we cannot discuss it as a body until the meeting takes place.
Robin Kauser, so there are two work group meetings that are going to take place before the next.
Potentially, yes. And you have the ability as the officer to assign work groups to particular issues. So,
Okay, so what was the work group? What's the work group that you're?
So we have set work groups. One of them is enforcement, one of them is education, one of them is
Licensing and standard of care. We don't have a rules work group, which is a common one, but not necessarily one that has to be done here.
right. That sounds like it may be a standard of care issue.
Is that what yours is?
I think you and I are on that.
Standard of care sounds like it would be the appropriate work group for
And
it.
you rattled those off a few
I'm
minutes.
so sorry. I'm going to go slower. So enforcement work group is Latricia and Helen. Licensing work group is Robin and Betty. Education and examination is Robin and Betty. And standard of care, which is the appropriate one that we would be discussing for this particular matter, would be Betty and Latricia.
Okay. So those two different work groups, the education and exam work group and the standard of care work group.
That's correct.
So my question is, not having met as a work group personally, does the work group meet and then report back to, just as this was provided, report back at the next meeting?
David Gonzalez, TDR. That would be appropriate?
Yes.
Okay, sounds good. All right, any other recommendations for the next meeting? Agenda items? Do you all have any?
Derek Burkhalter, TDLR. At one point in discussing with one of you, I heard a mention of a change of a test or a test name.
Mm-hmm.
Is that something we would want to add to the agenda for next time?
I'm not sure if I'm not sure.
Okay.
We have some time between now and the next meeting before we'd have to have the agenda posted.
Okay.
So if you come up with something, you have some time to get with our advisory board group. And I think we were going to wait on the next meeting scheduling so that we could get the rules back before we schedule the next meeting. Is that correct?
Correct. Because we are still waiting on the governor's office approval, and we still have to file some paperwork before the publication. We don't have that timeline quite yet, so as soon as we have a better idea of how long down the road we'll be after the 30-day comment period, then we can poll you to discuss the date for the next meeting.
Okay. Okay, so there's nothing else that we need to talk about for agenda for next meeting. Okay, well, with that in mind, I think that it is 11:34. Oh, 11, I think it's 11:32. And this meeting is adjourned.